Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
Welcome back to the Southern 7 podcast. I'm Shawnna Ryan. Joining me today is Jennifer Shackles. She is the Communicable Disease Program Manager for Southern 7 Health Department. Hello, Jennifer. Thank you so much for being with me today. I appreciate it.
Not a problem, Shawnna. Glad to be here.
Tell us a little bit about yourself for those who don't know you.
Again, my name is Jennifer Shackles. I'm the Communicable Disease Program Manager for Southern 7. I have been here for about 2.5 years. I came literally right before COVID started, so it was a very interesting intro into the Southern 7 community. I was born and raised in the Southern 7 area, literally a few miles down the road. So I am very familiar with the setup of the counties and what is offered.
Yeah, I think you started like right after I did here with the department, and kind of like with the rest of us here about that time who started, we just kind of got indoctrinated, just boom, just like that.
That's right.
So yeah, we kind of had that same background going.
A little bit of baptism by fire.
Exactly. Well, Jennifer, I want to talk with you today about getting ready for back to school, and the health department. Our focus is on back-to-school vaccinations and making sure that the kids in our region are healthy and ready to go back. So, first off, why should parents even vaccinate their kids?
I think the first and what feels like the most obvious answer to that is for them to be healthy. As a mom myself, the ultimate goal is always for your children to be healthy. And being here in Southern 7, this is not just a community that we're working with, it's our community. We take hold of that. Yeah. And we want our kids to be healthy. And also remembering that vaccines are helping us to prevent infectious disease and diseases and conditions that are not so common anymore that at one point in time were very familiar.
Right.
If you talk with anybody who was around whenever polio was prevalent or measles, or I can even remember myself having chickenpox before a vaccine was readily available. And just remembering that, yes, we are vaccinating against these, but that doesn't mean that if vaccine levels did not remain up, that those could not possibly come back. So.
Yeah, exactly. And, trying to remember that time before vaccines is a big deal. And I know I spoke with a former teacher in our community, and we got to talking about the smallpox vaccines. And I can remember getting that as a child. And I asked her, I said, how did that make you feel knowing that your own child was getting vaccinated? And she said, I cried. Just knowing that my child is not going to have to go through that same fear that I went through as a child, or that even that my parents went through when I was little. So, those that have been around before us, and like you mentioned, polio and even measles and mumps, we kind of take it for granted that they're not here now, and part of that is because of vaccines.
Exactly.
So it's important to recognize that. Now, how can parents find out what vaccines they need for their child and at what ages?
And this is one of these areas where I absolutely love my staff, because if you ask me directly to list those vaccines, I do not know, but I know that my nurses know. We have, of course, 7 clinics. As a parent, if you bring a shot record in, or if you have been vaccinated in Illinois and those are on the state registry, we can pull those up and we can tell you what is needed before a child goes to school and what is appropriate for their age group.
Now, are you able to look and see if a child has had a particular vaccine? Because I know as a parent, it's hard to remember what my child had from year to year.
It is. This is where it is very interesting because of where we live in the Southern Illinois region, with a lot of our community members going to, for example, Cape Girardeau or Paducah or some other area to receive care. We can't see into other state registries, which is also why if you're getting your child vaccinated in another state, we do recommend that you keep a hard copy of that. But if they are vaccinated in Illinois, we can bring up the Illinois registry and see what they've had.
So does it matter if they've gone through their pediatrician, or maybe they've gone through another health department in the state? Does that play into that at all? Is it all connected?
It should all be connected,
Okay,
yes, into the eye care system.
Okay, so it's easy to just go to your local 7-7 clinic and, because I know as a parent, it's hard to know, okay, did my child have the meningitis shot? You know, it's easy to look that up.
And it's easy to forget,
Good.
you know, what happens. And I know that I depend on like an electronic record that I have of my kids' shots. And sometimes it's, even if you don't have that hard record, if you have the name of the physician or the pediatrician group or whatever provider gave those immunizations, we can try and find that for you.
Okay, good. So that is one less concern that a parent would have.
Yeah,
at that
we
point.
try and take care of some of that investigation work for you.
Good, okay. One of the things that we saw during COVID, which I don't know if that's historically something that happens, but we saw a lot of vaccine hesitancy, and everybody has their own reasons for that, and I appreciate those reasons. What do you say to a parent that has concerns about, let's say, chickenpox or any particular vaccine? Is there anything that you want people to know when it comes to vaccine hesitancy?
As far as vaccine hesitancy, I feel like the main thing is that people are feeling that they are heard. And that we all agree that the main goal is to keep your child healthy. Our goal isn't, some people feel like the goal is to overprescribe. And that's not what we are trying to do. But also knowing that the FDA performs vigorous testing on vaccines before they are approved. You know, especially for child use. So I think one of the biggest things with vaccine hesitancy, because you will run a wide gamut of opinions on vaccines.
Right.
Some people don't want their child to be vaccinated at all, whereas some people want a delayed schedule, whereas other people are, I want them to have every single thing that they can ever possibly have. And the thing to remember is that it's not necessary that any of those answers are wrong. Many times whenever I find out that people are hesitant with vaccines, my first question is, I want to know why.
Right, yeah.
What's the reason?
Yeah.
Because very few people don't have a reason for that. They have a fear, a concern. That is something that needs to be addressed. And that may be something that we can talk through, and it might be something that we're not. Either way, we're going to encourage that conversation with your provider, with your physician, your pediatrician, with your nurse practitioner, and have that open conversation so that it's not a guessing game of what the other person is thinking. I tell people that I've never put telepathy on my job description. I never know what people are thinking or what they are wanting if they don't tell me. So please be sure to have that conversation with your provider so that they understand where you're coming from as a parent, as a guardian, what concerns you have and why you have those concerns.
Exactly. We just want to make sure that they have all the information, especially as a first-time parent. You're heading into kindergarten. It's overwhelming to begin with. And then you start thinking, okay, they have to have this vaccine and this whatever. Making sure that they have the information. And yes, you're right. Your provider is the person to go to, or you can contact your local health department. And
Absolutely.
they can help you with that as well. And you're going to be given the most current and accurate information that's available. And again, things do change. As we learned over the last couple of years.
We have definitely learned that.
We've learned that. But I mean, it's important to know that we're giving you the most accurate and current information that's available, and that's our goal, to do that. Very good. Now, as far as scheduling a vaccine appointment, again, I go back to the new parent brain on this one. What do parents need to know when they're scheduling a vaccine appointment with Southern 7? Is there any paperwork they need to bring? What do they need to have?
As far as scheduling, typically we will get very basic information at that point in time. Name, date of birth, do you have insurance? Are you the child's guardian? Are you the child's parent? Are you a foster parent? That gives us direction of what we will be needing whenever you come into the office. As far as whenever you come into the office, I always recommend that people give themselves a good 10-15 minutes because yes, there's paperwork. Unfortunately, like everywhere else, there's always paperwork. You will need to bring a copy of your insurance if you have insurance. If you are a foster parent or a guardian, you're going to need to see that guardianship paperwork just so that we can make sure that we have the appropriate people signing. And I know that we've had a few cases where, like, we've had to have conversations with the guardian or the parent because of a living situation that may not be traditional.
So a lot of little things. What about, you mentioned earlier, getting your vaccines out of state. You might not have access to those records. If you've got a child that's moving in from another state other than Illinois, do you require that information or to make sure that they're getting the correct, what they need?
It's not required, but it definitely helps.
Okay.
So sometimes it's not uncommon for us at all to receive a phone call and be like, my child needs their shots to get into pre-K or to get into kindergarten. I don't know which one she needs, but I see Dr. insert pediatrician's name.
Yeah.
Over here. And that at least gives us a little bit of a starting point to go, hey, I can get in contact with this physician. At that point in time, we will require a release of information so that they know that they can give us information on the child.
Right.
And then they can fax that over to us.
Okay, so that's not a major concern for parents. Good. Oh yeah, that's good to go. Good to know. Now let's talk a little bit about non-vaccines that are required for school, such as flu, COVID-19. Should parents be considering those as they move forward?
I always recommend a flu vaccine. That's a conversation that I feel, as far as like timing, needs to be had with the provider. Have that with your physician, with your pediatrician. And the COVID vaccines are new. I understand that a lot of parents have a lot of questions about them, and they should rightfully so have questions. So again, I recommend that is a conversation that's had with you and your provider about getting that, about when to receive those, and what is appropriate for your child.
Because again, you may have a situation where a child is allergic
Absolutely.
to part of an ingredient in a vaccine, or again, you got a parent that's still just not quite sure if that's what they want to have. So yeah.
Absolutely. And whenever you're speaking with your physicians or your providers, or whenever you come in and talk with us, please make sure, my child has this condition. We are allergic to A, B, or C. If you know that your child has issues receiving shots where they may faint or they may pass out, certain people do. That's something to have a conversation before we take the cap off of that needle. Okay? Not while that is occurring. But if you need to have a conversation, by all means come in and have that conversation with us. Part of our job is not just to be healthcare providers, but we are educators as well. That is a huge part of the healthcare community, is education of the community.
Exactly. Well, Jennifer, you've given us a lot of great information and good starting point for parents in our region. Is there anything else you'd like to share with them today?
Not that I can think of right offhand. We are a phone call away for anybody in the Southern 7 region. And if you call up to the main Olin office, even if that is not where you would be receiving your vaccines at, we can get you to where you need to go.
Okay, great. All right, well, thank you so much. I appreciate all your help in this. I really do. And if you can think of anything else going forward, let me know. We'll get it out to the folks, okay?
Absolutely.
All right, thanks a lot.
Thank you.
Once again, that was Jennifer Shackle. She is the Communicable Disease Program Manager here at Southern 7 Health Department.